Hi, I'm Dr. Bobby Mukamala, Board Chair of the American Medical Association. It is my great pleasure to present the 2022 AMA Awards for Outstanding Government Service. These awards are among the most prestigious given by the AMA. Previous winners include members of Congress, governors, public health agency leaders, and state and local leaders. Whether their sphere of influence is national, regional, or local, they are outstanding leaders in their fields. They have contributed greatly to improving public health, and they have promoted the art and science of medicine in or through government service. For the past 2 years, these leaders have shown exceptional fortitude and perseverance in responding to the COVID-19 pandemic, surely both an historic and career-defining event in all of our lives. Before announcing this year's award recipients, let me take a moment to thank all public officials who have worked so tirelessly over the past 2 years to bring about an end to the COVID-19 pandemic. We also recognize the hard work of those who are taking on the many health challenges that preceded the pandemic and will likely remain even afterwards, such as the drug overdose crisis, mental health parity, and systemic health inequities for historically marginalized communities. There were truly many impressive nominees for this year's awards, and it was difficult for the judges to select finalists. While we honor the tremendous heroes in our midst today, we know that there are countless others giving their all to public health who are deserving of our recognition and thanks. The award for Outstanding Member of a State Legislature goes to Cindy Friedman. Ms. Friedman represents the 4th Middlesex District in the Massachusetts Senate, where she serves as Senate Vice Chair of the Joint Committee on COVID-19 and Emergency Preparedness and Management, and Senate Chair of the Joint Committee on Healthcare Financing. In its nominating letter, the Massachusetts Medical Society describes Senator Friedman as masterfully legislating with a North Star uniformly set on the best interests of patients, especially the most vulnerable. During 4 years in the Massachusetts Senate, Senator Friedman has distinguished herself as a leader on numerous healthcare issues. During the pandemic, she has played a key role in crafting and passing legislation to shield residents from the devastating impact of sickness and job loss, providing housing and food assistance for those in need and financial support for small businesses. She championed first-in-the-nation legislation to promote broad access to medication to treat opioid use disorder and to promote harm reduction strategies. These are both recognized as evidence-based approaches to addressing the overdose epidemic and key priorities of the AMA. She is not afraid to take on powerful interests for the benefit of patients, pushing back against health insurers to expand telehealth services, fighting for mental health parity, and confronting the pharmaceutical industry over excessively high prescription drug pricing to make medications more affordable. Senator Friedman, on behalf of the American Medical Association, please accept our congratulations for this award for your outstanding government service.
Hello, I'm Massachusetts State Senator Cindy Friedman, and I'm honored to be receiving the AMA Outstanding Government Service Award this year. Thank you to the Mass Medical Society and the President and my good friend, Dr. Carol Allen, for nominating me for this award. Amid this global pandemic, I want to recognize the thousands of doctors in the AMA's ranks for your commitment to public service and for your collective efforts to keep all of us safe and well during these extremely challenging times. As a policymaker, I've learned a lot from this pandemic, and I've learned a lot from partnering with groups like the AMA and MMS. It's clear that we must address the many systemic inequities that impact healthcare. One approach is to ensure that the work of the doctor remains focused on taking care of patients. We all know that patients thrive when they're making connections with their doctors, and to amplify this, we must ease the burden that take doctors away from directly caring for patients, like time-consuming paperwork and insurance protocols that focus more on a carrier's bottom line than on a patient's well-being. Doctors should be evaluated on the quality of the care they provide and not the quantity of patients they provide for. Standards based on maximizing the number of patients seen are a disservice to both patients and doctors and reduce the quality of health care. And just as important, we must support and provide for a well-funded, well-staffed healthcare workforce to address the challenges faced each day by the medical field especially in this enduring pandemic. These things are worth fighting for, and I will continue to work with the AMA and the MMS in the years ahead as we strive for a more equitable, more accessible, and more affordable healthcare system for all. Thank you all so much.
I am now pleased to present the award for Outstanding Member of the United States Senate. This year's winner is Roy Blunt, U.S. Senator for the state of Missouri. Prior to being elected to the Senate in 2010, Mr. Blunt served as member of the House of Representatives for the 7th District of Missouri for 14 years. Throughout his career as a legislator, Senator Blunt has developed a reputation for working on a bipartisan basis to enact important healthcare legislation and to provide federal funding for health priorities and facilities. Among his many accomplishments, working with Senator Debbie Stabenow of Michigan to expand community mental health and substance use services through the Excellence in Mental Health and Addiction Treatment Act, which became law in 2014. Using his leadership position on the Senate Appropriations Subcommittee to win increased investments in biomedical research and significantly higher funding for the National Institutes of Health. And advocating for expanded telehealth services through and beyond the pandemic, including co-sponsorship of the AMA-supported Connect for Health Act. Closer to home, Senator Blunt was instrumental in securing funding for the Next Gen Precision Medicine Institute, named for him at the University of Missouri-Columbia campus. He also championed the expansion of the University of Missouri-Kansas City School of Medicine to an additional campus in rural St. Joseph, Missouri, which expands graduate medical education for students who will practice in states with primary care provider shortages. In nominating Senator Blunt for this award, Dr. Mary Jackson, Dean of the UMKC School of Medicine, credits him for his extraordinary leadership and unwavering commitment to improving rural health care, for making a major impact on the health of underserved citizens of Missouri. Senator, for your leadership on healthcare priorities that will benefit the people of Missouri and the entire country, the AMA is pleased to present you with our award for outstanding government service. Thank you.
Hi, I'm Senator Roy Blunt. I want to thank the American Medical Association for selecting me for the Outstanding Government Service Award. I'm also truly honored to have received this nomination from Dean Mary Ann Jackson at the University of Missouri, Kansas City Medical School. I want to thank her for the tremendous work she's done at UMKC, and especially for the medical school's campus expansion to St. Joseph, Missouri. What that really does is respond to our new emphasis on preparing doctors in smaller cities and near rural areas where we think they'll be more likely to serve if they've had a chance to train in that environment and find out the satisfaction that can come there. As the former chairman of the Labor, Health, and Human Services and Education Subcommittee, and now the top Republican on an evenly divided committee, I've spent the last 7 years focused on prioritizing investment in our medical research infrastructure, expanding access to mental health, and investing in the health workforce, as well as strengthening medical education programs. Over the past 6 years, we've been able to increase funding for the National Institutes of Health by almost $13 billion. That's a nearly 43% increase for NIH, and it's fundamentally changed the trajectory of biomedical research funding in this country, and it's also kept a lot of young researchers who were dramatically discouraged by a decade of no increase in the research field. We've increased NIH grant success rate, we've increased their buying power, and forever, I think, changed the prospects of scientists looking to cure our deadly diseases in different ways that are much more focused, much more personalized, much more based on looking at what you can find in that individual to help fight back. I've also been focused on restructuring programs to treat mental health like all other health. I'm proud to have worked with Senator Debbie Stabenow from Michigan to create the Excellence in Mental Health program, now totally in 10 states and partially in 41 states, where mental health for government payers, particularly Medicaid, is handled just like any other health. And I think what we're seeing there is within the immediate healthcare space, you save money if people are taking their medicine, going to their appointments. eating better, sleeping better, feeling better about themselves, their other healthcare costs are more easily dealt with in a way that more than offsets what we've always known was the right thing to do. I think this bill, frankly, may be the biggest step forward in expanding community mental health and addiction services in decades by really creating certified community behavioral health clinics in all of those states. We're hoping to expand that effort one more time in this Congress. Finally, if there's one lesson reinforced by the pandemic, it's the importance of medical professionals. We need to ensure that you have and they have the tools needed to do the job, but also support that you need to enlist at the earliest stages of educational opportunity people in healthcare training in the healthcare field. Over the past 6 years, we've increased Pell Grant funding to a high of $6,495. We've had an increase in that funding every year. We've restored year-round Pell and strengthened programs that support health professionals. We've also created a new student medical education program to focus specifically on states that have a physician shortage or will have one by 2025. Thanks especially to America's doctors, and thanks again for this recognition.
I am pleased to present the award for Outstanding Member of the Executive Branch in Career Public Service. This award goes to Dr. Peter Marks, Director of the Center for Biologics Evaluation and Research at the U.S. Food and Drug Administration. Dr. Marks and his team are tasked with ensuring that the COVID-19 vaccines that ultimately reach the public are both safe and effective, and have undergone a rigorous, evidence-based, and transparent process. Dr. Marks played a pivotal role in conceptualizing and implementing Operation Warp Speed, a public-private partnership between government and drug manufacturers to develop a COVID-19 vaccine in record time. In nominating him for the award, the Texas Medical Association credits him for the stunningly successful development of several vaccines in under a year, which have saved many, many lives. He brought the utmost integrity to his role in the process, even in the midst of highly charged political environments. Dr. Marks was instrumental in ensuring that physicians' concerns and questions about the vaccine were answered fully before and during initial deployment. And he continued to respond to the numerous questions from physicians about the vaccines and how to talk to their patients. Dr. Marks participated in numerous episodes of our webinar titled COVID-19, What Physicians Need to Know. Lessons learned during Operation Warp Speed may lead to faster approvals for numerous life-saving medications in the future too. Dr. Marks, for your exemplary, life-saving leadership during the COVID-19 pandemic, I am pleased to present you with the AMA Award for Outstanding Government Service.
I'm very grateful to the American Medical Association for this Distinguished Service Award. And I also want to thank those who nominated me for it. This really is a recognition, though, of the tremendous work that's been done by a group of individuals at the Food and Drug Administration of the United States in support of public health during this pandemic. I'm incredibly grateful to work with an amazing group of people, and together we've accomplished a tremendous amount in support of public health. I also want to take a moment to thank all of you for everything that you've done to help to deliver care during this most challenging of times. Thank you again for the recognition, which I truly appreciate. Thanks again.
The AMA Award for Outstanding Career Public Servant at the local level goes to Dr. Travis Gales, Chief Health Officer for Hazel Health and former Chief Health Officer for Montgomery County, Maryland. Trained as a pediatrician, Dr. Gales has dedicated his life's work to improving public health, and he has had a positive impact on many aspects of public health during his career. While Chief Health Officer for Montgomery County, Dr. Gales played an integral role in leading the response to COVID-19. His colleagues at MedChi, the Maryland State Medical Society, credit him with steadfast advocacy for focusing on the scientific data and population health guidelines, for making the difficult decisions required during the pandemic, even in the face of vigorous, politically motivated opposition. They firmly believe that the effects of the pandemic would have been worse had it not been for his leadership. Prior to his service in Montgomery County, Dr. Gales was the Chief Medical Officer of the HIV/AIDS, Hepatitis, STD, and Tuberculosis Administration at the Washington, D.C. Department of Health. He is also a published researcher on topics including bullying, violence, and adolescent risk-taking behavior. Dr. Gales, for exemplifying what it means to be a physician public servant, we are pleased to present you with the AMA Award for Outstanding Public Servant at the local level. Congratulations.
Thank you to the American Medical Association for this humbling recognition. In order to truly advance and improve the health and well-being of our residents, it takes collective action at the national, state, and local level. I'm honored to be in the presence of the other honorees and thank them for their efforts to keep us safe and healthy during these challenging times. Public health officials and healthcare workers have long been on the front lines of protecting our communities preceding COVID, often operating behind the scenes to conduct all manner of care to keep our communities healthy and safe. I would not be able to be here in this capacity without a significant network of support, both professionally and personally. On a professional level, I share this recognition with my team, the staff of the Montgomery County Department of Health and Human Services, and the Public Health Services team. In particular, I would like to thank Dr. James Bridgers, my then Deputy Health Officer, my assistant, Stella, and the countless staff from our disease control, licensing and regulatory services, and school health services team, Homeland Security, other government agency officials, our local elected officials, including County Executive Mark Elrich, our Montgomery County Council, and our medical advisory team of volunteer professionals, and the tremendous fellow local officials in the Washington metropolitan area, including my fellow health officers from Maryland, D.C., and Northern Virginia. On a personal note, I'd like to thank my family, including my parents, siblings, nieces and nephew, my two best friends, for all of their collective support, guidance, and care. Lastly, I'd like to thank the residents of Montgomery County who invited me into their homes to provide the best guidance we could to keep them safe, not only in COVID, but also as it relates to a host of other issues, from diabetes control to understanding the differences and impact of social determinants of health on health outcomes. Collectively, we can be even healthier regardless of the challenges we face. Thank you again for this honor, and congratulations to my fellow honorees on their recognition.
I am now pleased to present the award for Outstanding Career Public Servant at the state level to Dr. Mandy Cohen, former Secretary of North Carolina's Department of Health and Human Services. From the time of her appointment to the position by Governor Roy Cooper in 2017 until her recent departure, Dr. Cohen worked tirelessly to improve the health, safety, and well-being of residents of her state. One of her chief responsibilities was leading COVID-19 response for the state, which included operational response, advanced data collection, policy guidance, and serving as a trusted spokesperson. In nominating her for the award, Dr. Wesley Burke, CEO of UNC Health and UNC School of Medicine, describes Dr. Cohen as a bridge builder, creating connections with health leaders, frontline workers, and all people in North Carolina, who has constantly offered the people of North Carolina reliable information on critical times. Notably, under her leadership, North Carolina has become a model for equitable access to COVID-19 testing and support, and has narrowed the vaccination gap for Black and Hispanic communities. Dr. Cohen also has a passion for expanding healthcare access and addressing social determinants of health. She and her team have received national accolades for their work to reduce disparities for marginalized populations in the state's Medicaid program by integrating physical and mental health care and connecting patients with community services. Dr. Cohen, for your visionary leadership on behalf of the residents of North Carolina, the AMA is pleased to present you with our Outstanding Government Service Award. Congratulations.
Hello, this is Dr. Mandy Cohen, and I want to thank the American Medical Association for this incredible honor. Thank you for acknowledging the work of public servants at the federal, state, and local level. The past 5 years, I've had the honor of being the Secretary of Health and Human Services for North Carolina. the last 2 years leading the COVID response. It has been a challenging time to be in public service, but what an incredible honor. I hope more physicians will go into public service over the course of their career. I think government has an incredible opportunity to reach communities all across the country in ways that are incredibly important and impactful. I'm so proud of the work we've been able to do in North Carolina to build a healthier state, to really think about a whole person in our response effort, to think about equity, put data at the center of what we were doing, and certainly think about building trust between the government and the communities that we are serving. So it's an honor to be recognized. I want to thank the leaders at UNC Health, who I know nominated me for the award, Dr. Wesley Burks and others. So thank you so much for this recognition, and congratulations to the fellow recipients of this award, some incredible people. I'm honored to be amongst you. Thank you for your public service. And again, thank you to the American Medical Association for this acknowledgement and award.
It is my pleasure to present the award for Outstanding Career Public Servant at the local level to Dr. Sam Page, St. Louis County Executive and member of the St. Louis County Council since 2014. Prior to stepping into the top role in the county in 2019, Dr. Page was a full-time anesthesiologist at Mercy Hospital and an adjunct assistant professor at St. Louis University School of Medicine. Dr. Page has always brought a physician's perspective to this work in St. Louis County government. His colleagues at the Missouri State Medical Association credit him for leading his county's fight against COVID-19 using evidence-based approaches on masking and vaccines despite strong political pressure. He is also credited by MSMA for the establishment of a local prescription drug monitoring program, an important clinical tool to assist physicians in making prescribing decisions. Missouri was the last state in the nation to create a PDMP. To get around the legislature's intransigence, Dr. Page initiated and championed legislation to create a PDMP in St. Louis County, allowing other counties to opt in. The local PDMP expanded to cover 85 to 90% of the state's residents and physicians before Missouri finally enacted a statewide PDMP last year. In a letter supporting Dr. Page's nomination, former AMA President David Barb writes, "It is uncommon for a nominee for this award to have been involved in such a broad range of governmental service and to have been so impactful at each level." Dr. Page, we wholeheartedly agree. Congratulations on being this year's Outstanding Career Public Servant at the local level.
Hello, it's an honor to accept this award. I do so aware that I'm standing in for the true heroes of local government in a pandemic: the doctors, the nurses, the healthcare staffers, the communicators, the administrators, and the auditors. In neither of my careers, as a physician and as an elected official, have I ever seen a time like the one in which we now find ourselves. Never have doctors been so urgently needed and our advice so aggressively disparaged. This pandemic has shown the short-sightedness of decades of underfunding almost every aspect of public health and the tragedy of systemic inequities that have left poor people, people of color, and people with disabilities so much more vulnerable than their neighbors. My challenge in St. Louis, our challenge in the United States, is to meet the current health and economic emergencies while redesigning the institutions that largely have failed us. It's a daunting task made lighter by this award and the hard work of each of you. Thank you to the AMA, my colleagues, and especially to my family.
It is my pleasure to present the award for Outstanding Career Public Servant at the state level to Dr. Nirav Shah, Director of the Maine Center for Disease Control and Prevention. Dr. Shah was nominated by colleagues at the Maine Medical Association, who credit his leadership with Maine's exemplary response during the pandemic, characterized by relatively low positivity rates and high vaccination rates. Appointed Maine CDC Director in 2019, Dr. Shah first worked to fill numerous vacancies in the department, totaling 25% of the workforce. Once back at full strength, he turned his attention to Maine's ongoing public health issues, including fighting drug overdoses and responding to infectious disease outbreaks, soon to include the coronavirus. Through the pandemic, up until the present day, Dr. Shaw has given regular briefings to the public and the media, explaining COVID-19 developments in Maine in plain English and offering easily understood guidance for how individuals should respond. His accessibility and empathy have earned him a huge following on social media, including a Facebook fan page with nearly 40,000 followers. Their motto, keep calm and listen to Dr. Shaw. Dr. Shaw, for your exceptional, compassionate leadership during the COVID-19 crisis and beyond, the AMA proudly presents you with our Outstanding Government Service Award. Congratulations.
Hi, everyone. My name is Nirav Shah. I'm the director of the State of Maine's Center for Disease Control and Prevention. I am honored to be able to accept the 2022 AMA Award for Outstanding Government Service in the category of Career Public Servant at the state level. I'd like to take a moment to thank, in particular, the Maine Medical Association for nominating me for this honor. I'd also like to thank the AMA's panel of judges for selecting me for this honor, and the AMA at large for offering me this distinguished accolade. It is my great privilege to accept this award and join a long and rich history of prior honorees. The COVID-19 pandemic has presented one of the most challenging periods any public health official could ever imagine. Evolving public health guidance must be delivered daily to populations that are equal parts frightened, exhausted, and buffeted with misinformation. The fact is that nothing prepares you for a job like this at a time like this, other than, well, having a job like this at a time like this. But it's a job that state health officials around the country do every single day. I have been so proud to be able to serve in the state of Maine as the public health director and state health official, and I am honored to accept this award from the American Medical Association, sponsored in part by my colleagues at the Maine Medical Association. Thank you all so very much.
In closing, I thank each of our award recipients for demonstrating the type of bold, inspirational leadership that is possible even during these challenging times. Your example means more than you know. Thank you.